Okay, now let's talk about rectal cancer. So yes, the colon and the rectum are different. I'm going to make another video on that. Even though they're part of one long tube, they really function differently. So the rectum is approximately the bottom 20 centimeters of the GI tract before the anal canal. It sits low in the pelvis and is generally fixed in the pelvis, and that is why the treatment for that is different than the colon, which is in the abdomen. So rectal cancer is diagnosed the same way as colon cancer. It's usually from a colonoscopy and a biopsy. Once that biopsy is confirmed to be rectal cancer, the patient then undergoes staging similar to colon cancer. The staging is a little bit different because in addition to the CT scan of the chest, abdomen, and pelvis, patients will undergo an MRI of their pelvis, very specific protocol for rectal cancer. And the reason for that is because we want to see how big that tumor is, how thick it is going into the wall of the rectum, as well as any suspicious lymph nodes in the pelvis. At this point in time, we get a clinical stage. So we get to see how big the tumor is, if there are any suspicious lymph nodes involved. If there is a locally advanced rectal cancer, which means either the tumor is pretty big or there are suspicious lymph nodes, the patient then undergoes what is called neoadjuvant therapy. That means chemotherapy and radiation before surgery. Now, this is the point in time where protocols can be slightly different, but generally speaking, people will get radiation if they have a locally advanced rectal cancer, because what that does is it will shrink the tumor and it will also potentially kill any cancer in the lymph nodes in the pelvis. It also involves chemotherapy, which is targeting any cancer cells that we can't see on the imaging that may be floating throughout the body. Once the chemotherapy and radiation are complete, patients undergo another set of scans to see how the tumor responded to that therapy. If they had a good response, the patient then goes to surgery about 8 weeks to 12 weeks after the radiation was completed. The reason for that is because even after your last dose of radiation, it will continue to work for up to 12 weeks. So it's possible that the size of the tumor that we see on those staging scans you got done after the radiation, it may be even smaller by the time we get to surgery. The surgery involves taking out a part or all of your rectum, depending on the location of the tumor. I will say this, most patients with rectal cancer who have received radiation and chemotherapy will end up with either a temporary or a permanent ostomy bag. Now, during the surgery, we take out not only the portion of the rectum that harbors the cancer, but we also take out the lymph nodes in the area. We send it to the pathologist who looks at it under a microscope to tell us how big that tumor is, how thick and deep it goes into the wall, and if there's cancer in any of the lymph nodes. Similar to colon cancer, if there's any cancer in the lymph nodes, it's automatically a stage 3. We also look at the different features of the tumor to see if it's a high-risk tumor or a low-risk tumor. Based on these pathologic features, you then may need additional chemotherapy or you may be done. Now, rectal cancer is a multidisciplinary disease process. You have a gastroenterologist, a colorectal surgeon, a medical oncologist, a radiation oncologist, and a radiologist who are all treating you for this one problem. A lot of centers have patient navigators where they will have somebody that helps you keep up with all of your appointments, which I think is super important. Surveillance for rectal cancer is very similar to colon cancer. You will need a colonoscopy 1 year after your surgery, and you'll need continued CAT scans and blood work for the next 5 to 10 years. Those that may have received a temporary ostomy during their initial surgery will usually be able to have that reversed anywhere from 6 weeks to 12 weeks after their surgery. If you're in the Houston area and you need an opinion about rectal cancer, I have my office in the Heights. I'm happy to see you. Hopefully you never need me for something like this, but if you do, I am here.